Oh, that's a different Courtney. Courtney.
Yes, ma'am.
Okay. Oh, there is a Courtney Reeves. What's your last name is Courtney?
Houston,
Kingston. Okay, nice to meet you. Welcome aboard. We
pleasure
are
is all
going
you
to
all.
start in a minute, guys. I am so excited to have you all here. Do not go anywhere because tonight is about to go down. I am so happy that I am the one talking about this amazing opportunity. Let me tell you something, guys. I was on Facebook just surfing around. I have this particular group that I am in, and someone posted this opportunity, and I'm like, you know what? No, I am gonna go for this. Because anytime we
Okay.
see top dollars moving, I always like to tap in, especially if my agency or our industry qualifies. And in this particular situation, they are looking to award up to $2 million for HIV testing. And would I say ironically or fortunately, we've had similar
Oh my
program in
God.
the past that a particular agency is currently using. So that means something is working effectively. So I said to my team, I said, you know what? Let's bring this opportunity to the public. So that's why we're here tonight. So please do not go anywhere. We are going to get started in a minute shortly. I just have one more group to post this opportunity. Continue to drop your location. It's very important. What you do, start to imagining or start to see yourself in this opportunity. Every transaction, every top dollars opportunity, you want to position yourself for every opportunity. And we are here to break down this the request for this is actually a grant opportunity. So my team is here and we are so excited to bring this opportunity to you. Once we kick off, I'm gonna let you meet Benzie. Some of you have met Benzie. Some of you are currently working with us. Some of you have worked with us in the past. Why I am so eager and excited is because Benzie is bringing not just years of experience to the table. He also has had the opportunity to work with CDC. How many of you know CDC? The Center for Diseases and Control. Center for what? Center for Diseases and Prevention Control. That's CDC. For those of you that are in public health, CDC is one of the biggest agency in healthcare. So Benzie is not only with CDC, is actually with the funding department. So whenever top dollars are moving, they get to know. They are part of the board system and they make all of those decisions. So I have the opportunity to work with Benzie at the ecosystem level. Some of you have been following me for a while, so y'all know what I'm referring to when I say ecosystem. But like I said, when it's our time, we have just 2 more minutes. We're going to go ahead and start, and I'll let Benzie introduce themselves, but continue to drop your location. And I am just so elated to be here with you all tonight. And if you don't mind, go ahead and turn on your camera. Let's do it differently tonight. I see you, Takia. I see you, Miss Wanda, Mr. Lawrence. Welcome back here. Is it Pricks? That's probably one of my students. I see you, Courtney Reeves. Hello, hello, hello. Courtney is one of my favorite students, my collaborator, my colleague. I just so much love you, Courtney. You already know how I feel about you. Welcome. Courtney is a nurse practitioner. She is in Atlanta, Georgia, the metropolitan area. If you're looking for a collaborator, if you're looking for a nurse practitioner, a clinical lab director in Atlanta to be specific, Courtney is going to be your go-to. Okay. And also is with us, Shika Shah. Shika, oh my gosh, the number lady. Shika is with Benzie. They work closely together when it comes to funding government opportunities. Shika is your go-to, okay? They will be introducing themselves. Oh my gosh. Y'all say hello to Miss Daviona. Hey Shika. Daviona is also here. She's actually our physician assistant. Daviona is a doctor and she has worked with me on a couple of projects. I am so happy because she understands the vision and the mission of Coach Eli. So Daviona is also in the room. Good to see you, Miss Daviona. I see you, Candace Wallace. I see you. I see some names. Hey,
That's
Dr.
right.
J is in the room. Oh, make sure you come to class on Wednesday in 2 more days. Dr. Juliet and I have something cooking for y'all.
Because they're
So
look.
you guys will get to meet with Dr. Juliet. For those of you that wants to tap into the immigration space, that wants to work with, that wants to make money in your sleep, selling digital products, tapping into the digital space, we have that class. It's a free session as well. You probably want to be there on Wednesday. All you have to do is just sign up and show up. Dr. J is also in the room. Good to see you, Dr. J. Takia, I see you. Welcome, welcome. Takia is one of our students in Pennsylvania. Brittany says some, y'all. Go ahead and give Brittany a shout out. Brittany is a veteran. She's been serving our country for how many years now, Brittany? Quite a few years.
21 years.
Look at that. 21 years. Brittany has been serving, y'all. Yes, and she's trying to position her family and herself for into the diagnostic space. Let's see what we have on the second page. I see quite a few. Yes, so welcome. Just so happy to have you guys here. So 34 people. All right, without further ado, I'm gonna let Benzi and team introduce themselves and we can go ahead and start.
All right. Good evening, everyone. My name is Ben C. Pierre Lewis. I'm currently having some
Benzi, your
difficulties.
camera is off, just so you know, we can't see you.
Give me a quick second. All right. Can you all see my? Oh, see. All right. Can you all see me?
Yes.
All right, perfect, perfect, perfect. All right, good evening, everyone. I hope you all are doing well. Again, my name is Ben C. Pierre Lewis. I am the CEO of the Public Health Evangelist. We are a public health consulting firm where we help businesses, nonprofits, healthcare clinics, labs, uh, anything in any type of organization really get funding for their programs and also help them get clarity on what they do. So with that, some of my background, and also let me share my screen while I'm here. So my background is I am a former CDC National Center for Chronic Disease and Health Promotion strategist and project manager. So during my time at CDC, I was working with the leaders in diabetes, working with the leaders in population health. Coordinating with people, some colleagues in the HIV center and the STD center and the obesity center. So all across everything that we think of in terms of health topics, I either worked with leaders in there or collaborated with have some co-workers there. So I was able to work with some of these top-notch programs with their strategies, see the money go out the door, and also talk and interact with the people who actually signed off the checks as well. So that's part of my experience. I'm also a certified health education specialist and also a public health consultant. And these are some of the organizations that I have worked with in the past. So I attended Emory, but I also worked with Morehouse School of Medicine, University of Florida, my alma mater, Carter Center, and a couple of other organizations since then. The list has grown, so I should probably make a note for me to update those slides. But it's been a pleasure just working with y'all. I want to turn this over to Shika.
Hi everyone, glad to meet you all. My name is Shikha Shah. I am a pharmacist turned epidemiologist. I did my pharmacy from back in India from Mumbai University and came to the US to study global health and epidemiology. Since then, I have been at CDC at the National Center for Chronic Diseases as well, doing the data analysis and crunching numbers for them wherever it was assessing if your program is doing well, which counties are doing well, which counties are not doing well, how much funding is allocated across the states. That's exactly where I would be sitting at. And I met Benzi at CDC, and since then I have been working with him in public health evangelist as the chief consultant over here. Glad to work with y'all, and looking forward to our conversation today.
All right, thank you so much, Shika. Thank you so much.
Mm.
So just want to let y'all know that you have a team with federal experience who's worked with different leaders, who's able to see where where the top dollars are. So just know we're excited to be here with y'all today to talk you through some of these opportunities. So with that being said, let's dive into the presentation. All right, can y'all see my screen? All right, perfect.
Yes. Mhm.
Sorry, give me a quick second. All right, so let's talk about today's opportunity. So, as Coach Eli mentioned, today we're focusing on an HIV STD hepatitis opportunity in the state of South Carolina, and we also have a couple of other opportunities for you. If you're not located in South Carolina, we got a bunch of other opportunities for you where you can tap into millions of dollars, billions of dollars allocated for HIV, STD, chronic disease, really across the U.S. and across the country. So, with that being said, let's talk about the specific opportunity. So, this is opportunity number one. So we have this opportunity, essentially where they're funding different organizations to do HIV testing, HIV testing, STD testing between summer of this year to next year, and the total amount of money that they're allocating for this specific opportunity is $2 million. This is available for this whole entire program, and let's talk about what this program actually looks like. So again, key eligibility criteria. So this is specifically again. So with this, we're essentially looking for a prime who's located in this area in terms of South Carolina. But again, if you're not located in this area, there's plenty of opportunities for you to be a part of this, which I'll cover later. But essentially, we're looking for someone that's based in South Carolina and also has a CLIA waiver. And Coach Eli will talk about that as we go. But let's talk about more about the program. So, what's being funded with this program? Is they're funding HIV, STD, viral hepatitis prevention, and they're also doing syphilis screening. They're also looking to have capacity building. So, meaning if you happen to have a lab where you have interns or you're training others, they're looking for people to also be able to provide these capacity building opportunities. And then we're also looking for someone to do ending HIV, which is stuff pertaining to pertaining to prevention. So let's talk about the fun stuff about what this opportunity looks like. So let me ask this real quick. Who does HIV testing in as part of their business or are thinking about doing it? If you put yourself in the chat, who currently does HIV testing or thinking about doing HIV testing, or someone that's been impacted or have done any type of prevention work. Okay, HIV education. Okay. Perfect. I'm pretty sure there's a lot more. So the core thing is we all know that HIV is a hot topic. It's a chronic illness that plagues our world. So with this, from a public health prevention, from a public health standpoint, oftentimes, I'm gonna tell you this, oftentimes a lot of people don't know that they've been they go undiagnosed, and it's not until it's too late that's when they have to either get treatments or unfortunately they suffer the consequences of being undiagnosed and either pass away from their sickness or get a plenty of other chronic diseases uh, because of their HIV status. So, with that being said, essentially how public health is really focusing on this issue right now is prevention, prevention, prevention. If you look across every single ad you might see around HIV, if you watch the Super Bowl, there were some HIV ads. Everything's focusing prevention, prevention, prevention. So with this, there is four main components that there's three components to this specific opportunity, but there's four different areas that they essentially need us to do this work. Is one, diagnosed. So this is doing in-house and outreach HIV testing and also STD screenings. After that, it's treatment. So people who are diagnosed, they need to be referred to care. So it's referring them to get care, referring them to get treated for HIV for their HIV status, and also for those who may be undiagnosed, for those who do not have it, or those who do, it's with also having this prevention aspect through PrEP and PrEP or Doxy PrEP. So having PrEP education and also referring and condom distribution, harm reduction, etc. And then lastly, which is one of my favorite, is responding. So as you know, sometimes there's these disease outbreaks that happen. Unfortunately, being in the South, because I'm based in Atlanta, there is a high number of HIV. Uh, there's an HIV outbreak typically in the North and the South, and really across the country, depending on what state you're in. So with this, there's also you're also looking for a coalition or a collaboration of organizations to come together. If there's an outbreak, you can travel to South Carolina to respond to an HIV outbreak or response as needed, depending from the state. So this is really the core focus. They're looking for diagnose, treatment, prevention, and emergency response for HIV, STDs, and viral hepatitis. Does any of you do any of this work? Any diagnoses, treatment, prevention, or have y'all been in on any like emergency responses?
Joe, Joe.
I work with our local health department, so I do Hep C and HIV testing.
Oh, thank you, thank you, thank you. Yeah, I'm glad. So yeah, you see the underground reality. So yeah, all of this is needed. All of this is needed. You want to talk more? Do you want to maybe give a little bit more this back context to some of the things you've seen in your work with the local health department?
Yeah, I have a question. So I
Yes.
do mobile phlebotomy blood work, and I've done HIV testing with blood work. I'm not sure what type of testing that they're looking for, so I don't know if I could get more context on that.
Yes, yes. So yeah, this is just the first part of there's like a little bit more in terms of like with the different types of tests, but I'll let Dr. Elizabeth go.
You want me to come in, Benzie?
Yeah, I saw you were off mute.
Okay. So, as you can see, it says in-house and outreach HIV testing. So we could do the rapid testing, and I think that's what we're going to lean on because we want to do rapid testing and be able to give rapid same-day testing results. So it's going to be in-house. So when we say in-house, we are doing rapid testing. And once we figure out who are positive for the test, we would then also treat. So that's where the diagnosis is coming from, right? And recruitment would also come as outreach. So we're going to outreach to people and also wants to integrate STD testing. And Daviona, if you don't mind, steer us in the right direction. Would this be something that is feasible with doing in-house testing for HIV? Is that
Sorry, I
being
had to
okay?
step away. Yes, that's feasible.
Okay. So yeah, rapid testing, easy pricks. Okay. Then once we
All right.
identify positive test results, we are then going to treat. How do we treat? PrEP, NAP, doxypep, even education, right? And those that comes back negative, we want to teach them education, practicing safe sex or safe sex practices, distribution of condom, harm reduction, right? So that will be the pattern.
All right.
Thank you,
All right,
Benzie.
great. So if there's any other questions as we go, feel free to let us know. So with this, they're looking for at least 400 test minimum. So that's people who are done through in-house or outreach services. And I know it might seem a lot, but think about it. In these areas, especially in South Carolina, there is a bunch of organizations who are doing events each year. Think about the festivals. Think about festivals. Thinking about community health fairs. Thinking about concerts that happen in these big cities. There is a bunch of traffic that's happening. So they're looking for at least 400 test minimum through in-house or outreach services. But especially in rural areas or even in urban areas, there's a bunch of opportunities to do testings or to do screenings. After that, they're looking for syphilis and capacity building. So looking for syphilis screenings. So a minimum of 200 screened annually. So they're looking to provide direct syphilis screenings, linkage to treatment, partner notification. So the same thing for HIV and STD, the same thing for HIV, same thing for syphilis. Screen, link to treatment, do education, let them know of their test results. After that, they're also looking for if you currently do trainings, if you currently do workforce development, or if you can also maybe even teach some of the things that you do. If you have others that you're training right now, they're also looking for those that can train others to do this type of work, whether it's through professional development or whether it's through training others to do testings or diagnosis or even interpret a result. They're looking for capacity building as well. So if you love teaching, there's a component to this too. And then lastly, for this is for component C, is they're looking for mobile HIV testing. So if you have a mobile testing lab, they're looking for individuals that can come together to do mobile testings, at least minimum of 5 mobile event testings. So think about it. If there's a big event or even a small event or a rural area, and you happen to be and you target those areas, just looking for those who can do mobile rapid HIV testings. And then they're also looking for those to also do PrEP, and then PrEP, like you mentioned earlier, and then also integrated STD and then viral hepatitis screenings. So long story short, there's $2 million that is available for this opportunity. All of it is focused really on prevention, 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 and prevention. After that, there's PrEP. After that, there's mobile HIV testing. But there is a lot of money allocated for this opportunity. All right. So this, if you're not located in South Carolina, this might look a little bit unfamiliar, but essentially what this is saying is they allocated money for certain areas. They're allocated money throughout the whole entire state. So depending if you're interested, depending on the prime for this opportunity, let's just say there is money that's available everywhere for this opportunity. So altogether, I know we said 2 million that's available, but there's also looking for other type of contractors to do this work. So we're aiming at least for this opportunity at least 500,000 for this project. So this is the max that we can get as a collaboration for this work. So we'll make sure we'll talk through a little bit more of this as we go. So how this is going to work? So let me give you a brief background just to break this down easier. When we see these type of opportunities, do you know what typically happens? You have labs, you have organizations that just apply for it by themselves. If you think about your services, could you potentially do all of this by yourself if you're running a one-man show or one man or one woman show? Could you do the testings, the case management, the prep, the navigations, and also manage the day-to-day operations of your lab if you're doing this by yourself? Let me get your thoughts. Could you potentially do it by not at all? Nope. Mm-hmm. No, sir. Mm-hmm. Mm-hmm. So this is, but that's the reality. A lot of organizations, they just apply for these opportunities, they just reach out, but they don't have the capacity to do every single thing. And yep, yes, Yvonne, that's why we are stronger together. So our approach to every project that we do is collaboration, collaboration, collaboration. Because when we're working together, we're able to cover all of these different pieces. So, for example, in this case, it's like, okay, you have like I said, this project or this RFP, this opportunity is based in South Carolina. So you have one person that's based in South Carolina, right? That's managing or sort of the in-person presence. But then there's also you have those that are doing the HIV testings, that's doing the mobile outreach. I might not have the mobile outreach. You have the mobile outreach. So you're going to do the mobile outreach. And so you're able to travel or come into state to do the testings. Or you might have someone that's like, okay, I don't want to do the testing. I'm still new to this, but I have case management experience from my 9 to 5 that I had. So I can talk to people, I can direct them to services, I can follow up with people. Or you might not be interested in case management and you want to do prep. Then it's like, okay, I could screen people for prep. I can do some education on how people can implement prep and make sure that they get their medications day to day. Or I could also do data. I like numbers. I can do reporting. So essentially, this is why we do this as a partnership, collaborative approach. So that way, instead of it being one organization, we increase the likelihood of us getting the grant because we are coming together not as one, but we're coming together as a full team. Based off of experience at CDC, working with at HIV, working in chronic disease, this is actually what the federal government strongly encourages as part of these opportunities. They strongly encourage collaborations so you can get the work done. So this is why for this program, like we mentioned earlier, there's the diagnose, there's the treatment, there's the prevention, there's the outbreaks. This is why how this is going to work is we're going to do the testings. We're going to have mobile and outreach testing. We're going to have prep navigation, prep education. We're going to have case management. We're going to have clinical lab support, and then we're also going to have data. So meaning if you're currently located outside the state of Carolina, let me guess. Out of these things, what are some things that you can do from your home? You can do education. You can do prep navigation from home. You can call people from your state. You can crunch numbers from the reports that are coming in. Case management. You can have a conversation with a patient to educate them on their test results. If they need referrals, you can easily hop on your computer and say if they're struggling with housing or they're struggling with resources or they need to get primary care, you can honestly just go online, search a couple of resources near them, and direct them to the right resources. They lost health insurance and they're trying to figure out, okay, how do I find health insurance for HIV? You can direct them in the right resources. You can do treatment. You can give them a call, etc. Clinical lab support. There's screenings, the prep support. Also, like I said, the outbreaks that they might have, or they need people to do these big testings for these big events. You can also travel in state. You can travel to South Carolina to support for a big initiative to do screenings for 1,000 person event or 2,000 person event. So this is some ideas, but just want to stop here for a sec. I've been seeing the chat. I see capacity building, case management. Cherie, I'm case manager. Does anyone want to just chime in? Dr. Elizabeth, you want to chime in terms of how this partnership could work?
Absolutely. Thank you so much, Benzi. I don't know if you're seeing my thumbs up. I love how you're hitting the nail on the head. Exactly what I wanted you to say. Beautiful. And that's what my people need to learn to understand that we don't, and I don't, if you have win a government contract on your own, just come out and let us know right now. And I bring Benzi here for a reason. We just don't like to talk. We like to show our excellence or show expertise in what we do. CDC recommends that we collaborate. And as you can see, speaking of $2 million projects, you can't, there are multiple facets to this process, right? We want someone that will help navigate the system. Navigation simply is scheduling, calling, scheduling an appointment, set an appointment. Who is going to treat? Who is going to collect this specimen? Who is going to diagnose this test? Who is going to interpret the results? Who is going to collect all of this data, right? So we believe in collaboration and going in, tapping into these dollars as a team, right? So the only thing is there are some requirements, which when I saw this opportunity, I know for sure we can win this. We overqualify. And some of you've seen that I had to put out a small group chat where I was soliciting or asking for those of you that are in South Carolina. So typically, this is what we've done in the past. When we do collaborate, the first thing we want to do is identify who the prime is. When we say prime, prime is the person that is located in the area. So in this case, South Carolina Department of Health is giving out money for HIV testing. So we need to identify who the prime is. And I know some people have reached out to me. They said they wanted to be the prime. Now, once we've established the prime, we always look out for the prime because the prime gets to do more work. So when we break down this proposal, we give prime more. So let's say we're working with $2 million. Based on the number of people that wants to collaborate, we decide, but the prime gets more because again, we are using their name and their influence, pretty much. But as far as what we want to do here is we want to do four things based on the project. We want to test. We want to interpret the test. Interpretation has to do with diagnosis. We want to diagnose to see if these people are either positive or negative, right? Then we want to refer them out for treatment. Now, once they've tested positive or negative, we want to refer them. And those that don't need treatment, we also want to continue to do education and offer wraparound services. We also want to be able to do capacity building, right? Capacity building has to do with health education, introducing education into everything. So showing people, just having that I think it's more like a template, if you allow me to, just for lack of better terms. But that's what we want to pretty much do. I don't know, Benz, do we want to open the floor now for Q&A just so people can, instead of us just, do you guys want to ask questions now or we want to keep moving forward? Does anyone have
I
any
think we
question?
I was gonna say I can keep moving. I do have a couple more information for y'all, at least as it pertains to this activity. Actually, honestly, I think that was the last slide before I went into the multi-million portion. So yeah, just to reiterate what Coach Eli mentioned is there's so many different opportunities for this in terms of this RFP. They're looking for people to do HIV, just HIV testing, diagnosis. They're looking for someone to do screening, the syphilis screenings, PrEP follow-up, etc. So meaning if you're based in the States and you're interested in being the prime, then you would be sort of be the point of contact for the state health department to communicate. But then if you're located outside the state, then I'm just telling you, be ready. If there's an event where you need to do rapid HIV testing, then we'll make sure we plan that ahead of time. God willing, we're awarded, planning ahead of time, saying, hey, we're going to need Wanda from May 15th to May 18th for this big event to do rapid testing, or we're going to need Courtney to do PrEP screenings, or oh, there's a huge health fair that the state is hosting. Okay, we need someone at the screening station. We need someone at the PrEP station, or we need someone just to communicate with people as we go through this opportunity. And then we also mentioned this is that this opportunity is also could be a door opener because guess what? HIV is just one of the infectious diseases. Think about the infectious diseases that are happening right now. There's measles. There is smallpox. There's a couple of other, and also South Carolina just had a measles outbreak in a specific area. Hundreds got diagnosed with measles. So, meaning as being part of this opportunity is yes, we're targeting HIV, but then it also opens up opportunities for you to get funding for your business, funding for your lab, and also be able to develop partnerships. So we can ask any questions. Let's stop right now to get some questions before we move on to our second opportunity, which I'm excited to talk about.
Okay.
I have one suggestion for you. So most community organizations and Benzie, I don't know if you or Dr. E or anybody on this call is in a fraternity or a sorority, or for a larger organization, but most of them have health fairs, and there's a health group inside of each one of those groups that do health fairs every single solitary day. So those people are already on the ground in the city. They know the city, they know the parameters, they know what's there. Having letters of partnerships for each one of them. Whoever you get as a prime needs to have connections to community groups that are already established. You cannot recreate all of this all at once. You cannot go in and try to figure out, because I've been through Aiken, but I ain't been in Aiken. So what I'm saying to you is you need organizations that serve those communities every single solitary day and is looking for those partnerships. They will be very happy to write letters of partnerships, making sure, because they would want people to come in and do the testing. What they don't want is one hitter quitters, meaning you're coming this year because you get this big grant and you want to use us, and then you disappear. So when establishing whatever that is going to be established in South Carolina, it needs to be consistent. It needs to be something that has some longevity. And with all of this, being that there's this big spot, the government don't give out money for places that's flourishing in resources. They need somebody there. I looked at the first group of people for the most amount of money that they were funding for. That means that that is the area that has the highest population of people with the highest need. And I need people to understand about grants. That's what grants work. They don't give out money for places that's doing well. They give out money for places that have needs. So if we could also, in the midst of you looking for a prime for that area, make sure that that person understands that they absolutely need to have those partnerships. There needs to be letters, and there needs to be connections with whatever's going on in that area. There's a big gap of services. So I could actually help you with that part of it when you get to the place where you're needing to actually request letters. But you definitely need that because they are already on the ground. You don't want to start from scratch with this. And because the grant is due in such a timely manner, putting that information together. And I see some other folks that's on here, whoever it is, whether it's the sororities, fraternities, the NAACP, whoever it is, those people would be more than happy to help. So that's all I want to say about that.
Yes, thank you so much, Ms. Wonder. I don't know if you see Benzie and I smiling. This is actually our approach. This is what we do, right? Not to take away from your suggestion. The other half of Benzie's presentation actually covers what you're already saying. We have this other approach where we don't do it. So it's called the proactive way. So we have two ways of looking for money. We react. So this is what we are doing right now, reacting to this grant solicitation. So this grant is asking for proposal. And the other way when we usually getting money is proactive. So we don't wait for people to ask for money. We write letters of what is the letter? We write all of Benzie, what are these letters called that you write to this prospective sorority agencies, and it will cover that in this later part. But yeah, we're on track. This is exactly what we do and how we solicit or get money, and just to expand our territories, something like that. Benzie, if you want to chime in.
Yes, yes. Thank you so much for chiming in because that is exactly it. Like Shika will even tell you, like our approach for all the projects we've been doing is all about sustainability, sustainability, sustainability. Our goal is not just to have one project here and then we leave, we got the money, then we went out, but the goal is to establish those long-term relationships, to establish those partners, and to really solve the problem that's in the area. So that's why I mentioned like we're gonna put our best foot forward And then we're going, and I actually like the idea, like you mentioned, collaborate with those the fraternities, the sororities, the community-based organizations who are doing this, who have the ideas in place, but they're always again looking for partners. So even I'll even say this, even with this is an opportunity that even if we're not awarded the grant, this is a relationship builder. This is a relationship builder that way we can start even having a foot underground for HIV prevention. And God willing, even if it's not this year, at one point, this opportunity is gonna come back. This problem ain't gonna disappear in 1 year. So this opportunity is gonna come back. So guess what? While we're waiting, while we're building those relationships, let's know we have a plan in place. We're already doing the work. We're already communicating to the point where instead of reaching out and announcing, who you're gonna call? You're gonna call us because we already have the partners in place. We already have the collaborators in place. We already have the work plan in place. We have the budget in place. We're just saying we're ready. Just let us know and we'll execute.
Yes, I told him. Yes, I
Okay,
told him.
Benzie, I'm going to say just go ahead with the second half, which will solidify Mrs. May's suggestion. So you can show them some of the agencies that we typically work with when we're proactively looking for funding.
Yeah. So can y'all see my screen? I know the slides are a little bit tiny, but let me give y'all some context. So this, like we mentioned, this is the reactive route where we're responding to an opportunity. The thing is, with the reactive route, respond to a grant, there's no guarantees. If someone tells you that you'll automatically get this opportunity, they are lying to you. Run far from them. This is why we let y'all know that even with the South Carolina opportunity, it's not guaranteed. There's an opportunity. There's a chance we could come up with the best proposal. We have multiple people together, and we have a full plan, and we might not get it. That's why I mentioned. This is why I mentioned. Even if we don't get it, we're still going to build those relationships. We're still going to have this proposal because guess what? The opportunity is going to come back. But this is also why I'm going to mention this. We have something called the proactive route. This is where we have something called really this multi-million-dollar approach. So this is where we come up with the program ahead of time. We come up with the opportunity ahead of time. We come up with the proposal ahead of time. And instead of waiting for a proposal, instead of waiting for a funding agency to announce this is how much money we have, we identify those areas that are high need. Then we also identify those funders that are giving the money to get the funds for the program. So instead of waiting, we're going straight to the people that have the money. This is our plan. This is our program. We plan to do HIV testing, syphilis screening, mobile testing, PrEP, etc. We are ready to go. Give us the money and we can do the work. So this is our proactive approach where instead of waiting, we come up with the program and we go directly to the funder. So how this works, like I mentioned, for the HIV opportunity, there's HIV testing, syphilis screening, mobile testing, and PrEP. So instead of tailoring it for just for South Carolina, this is where instead of targeting one state, we target as many states as people are in the collaboration. So how does this work? I'm gonna get through this. This is the same program that we're essentially going to pivot and pitch to different states. So we're going to do testing, we're going to do intake, we're going to do screening, education, and results. These are the type of screenings that we're going to do, the type of tests, the different types of linkages to care, etc. So how this works is same program, every state, every organization is the prime. So let me talk about this. So remember how I said that we come up with the program, we approach one funder? Imagine we have 10 people. You have 10 labs that are doing this work. We all come together. We all come together under one program. So guess what? We had 10 people. What we do is we identify 10 different funders in each state. So let's say for this program, we say we have $1 million, right? And then we approached 10 different people because you're in South Carolina, Shika's in Georgia, Courtney's in North Carolina, Wanda is in Detroit. So we have all these people in different states, right? So let's say this is a $1 million program that we come up with, and we have 10 people. Let's say all 10 states say yes. All 10 funders say yes. How much money did we just get awarded? 1 million times 10. How much money did we get awarded? How much money? How much money? I'm trying to see the chat. How much money did we
10
get
million.
awarded? 10 million. 10 million. Mm-hmm. 10 million. $10 million. And guess what? Imagine that you were written into this budget for $100,000. Your $100,000 just became 1 million. 1 million that you made based off of grants. You didn't do more tests. I mean, you did more tests instead of grants, but you didn't have to sit on your computer all night reaching out to different clients, trying to figure out your marketing, try to do this, try to do that. You just got $1 million based off of having these contracts. And yep, Wanda, I agree. Once this is written, now contracts across the country are easy and quick wins. So let me explain. Let me explain to this to you. Let me also mute real quick. Let me tell y'all what's going on. So with this opportunity, there's 10 different people in 10 different states. We're doing this proactively, right? We already have the program in place. Guess what? What's going to happen is the state health department, the county health department is going to be like, oh, we have an HIV. We have an HIV outbreak again in 2027. Oh, we have an HIV outbreak in 2028. Guess what they're going to do? They're going to release the same opportunity again. Or guess what? If you're already doing the work, they're going to be like, we have this outbreak. Someone's going to be like, wait, how about we contact Coach Eli's group again in South Carolina so they can do this work. So this is why we have this opportunity where every person, no matter what the state you're in, whether you're new, whether you're a new business owner or you've been in the game for a while, you become the prime for your state. So guess what? Everyone that's located outside the state, they're going to provide the same support. They're going to provide the mobile testing. They're going to provide the case management. They're going to provide all that information. Is this making sense? Is this making sense? Is this making sense?
Yes.
Perfect. So let's talk about this. I mentioned funders, so let me talk about this even more to give y'all some examples. So this goes in depth how we target different managed care organizations. So these are your health insurance companies. They're required by law to give 1 to 3% of their total revenue back into the community. These organizations, they're making billions and billions of dollars each year. So they're required to give this money back into community organizations. So they're looking for organizations to do this work. You have different national foundations who are located in different states who are looking to fund this type of programs. And guess what? There's foundations that exist specifically for HIV. So I'm gonna give y'all an example. Georgia, we got I can't even pronounce the name correctly. My glasses are off, but we got the Centene Corporation. They're a big Medicaid MCO. They fund stuff for community health. They're looking to keep people outside the hospital. So what they're gonna do? If you have a big program in place, a solid program in place, they're going to want to fund the HIV prevention program to keep community members from using the hospitals and using in decline and decreasing their revenue. North Carolina Foundation, this is the Blue Cross Blue Shield North Carolina. They're looking on doing stuff for HIV prevention. Florida, they got the Gilead Compass Initiative focused on HIV epidemics in southern US and in the southern US. You got the Robert Wood Johnson Foundation. They're looking to address health disparities, HIV. If you're Texas, AIDS United, they're looking for organizations to end the HIV epidemic. So you see, you got different foundations, different organizations, different states. They all have one thing in mind. and HIV. So imagine you come together with a big, solid program and you're located in these different states. We just increased our likelihood to get $10 million from this program. This is why we call it a multi-million dollars. And guess what? I'm not even going to say this. Some of you might be like, okay, I hear what you're saying, but I'm still trying to get people into my lab. Can you tell me a little bit more? Imagine that you join this package, right? And imagine that you join this collaboration, and we pitch to a Blue Cross Blue Shield, right? That's a health insurance company. If we get it or we don't get it, guess what? You just built a relationship with someone that you can eventually become a vendor for. So, meaning if they're looking for someone to do HIV testing in their community, guess what? They're going to call you because you're the one that has the expertise. You're the one that has the network. You just built you just built credibility and authority because you came to them with a strong program. So I know I said a lot of information, but the thing is, we target different organizations, more organizations across the country. That way is you can actually be the lead and you can also make the impact for your program. So what this is going to look like, I just gave you an example for South Carolina. Let's say we target this foundation, right? Let's let's say we target this foundation. You're South Carolina, you become the prime, right? If you're in Georgia, you can do data. If you're in North Carolina, you can do if you're in North Carolina, you can do case management. If you're in Texas, you can do data entry, etc. Let's say we on the same package, you're based in Georgia. Let's say you're based in Texas. Let's say you're based in Michigan. You could do case management. You can do mobile HIV testing. You can do clinical prep. You can do education, etc. So with this multi-million dollars, it doesn't matter what state you're in. As long as you're part of the collaboration, you have everything you need. You can still support this work to reduce HIV from where you're at. So with that being said, and then with this, what we do as part of this is that with this program, you don't have to do anything. We take care of the proposal writing for you, and then we identify those funders for you. So we handle reaching out to those funders in your local state. We're going to give you their contact information. We're going to get their emails. We're going to schedule a call with them. And once they say yes to the call, we talk to them about the program. They say they want to give us money. Money secured for your business. You just scaled your business 10 times over. So I'm gonna stop here for a sec. I don't know if Coach Eli want to mention anything.
Not really. Thank you so much. We're gonna dive right into Q&A. But we have two opportunities for you guys. The first one is responding. So we are reacting to the opportunity that is being presented in South Carolina for HIV testing. And we have three opportunities. One is required and the two are optional. The required one is for us to conduct rapid testing, treat, respond, and treat and respond. And the second opportunity is syphilis and hepatitis, I want to believe, which is optional. And I don't think I want to go for that because we don't do that in the CLIA diagnostic lab. And that might require more work. I haven't done syphilis before, so I'm going to stay within my lane. Then the third one is capacity building, which I am going to go after because I see a lot of we educators, I'm a public health educator. Benzie is, we have some nurse practitioners in the house. I've seen some physicians, I see case managers and all that. So yeah, these are the three opportunities right here. The required one is the HIV, STD, and viral hepatitis prevention, which we are going to do. B is optional, C is optional, but we are going to do A and C. So two primes have identified themselves, I think Ashley and Miss J. We just have to go with one of you guys and based on I'm gonna have to do an interview with you based on your strength. Then we're gonna choose our prime. So if you are interested in this collaboration, Benzie, can you go to the so again, it's a done for you guys. You are not going to do anything. Benzie has, we have a team where we take care of everything. We don't write grants. Our work is beyond grant writing. We make sure we pitch. Well, that's going to be for the second proactive opportunity. But for this reactive, we are going to submit the proposal, everything that is required in this RFP, and we are going to submit it. We are only able to take on, I want to say 7 people for this project. I'm already on there, so we have 6 more slots. And like I said, they are looking to give 2 million across. Is it annually? I want to say, but basically go back to where the $500 opportunity is. The calculation for the $500 in total, I think we are able to write.
This one?
Yeah, it's 2 million, but I think you said they are going to award $500,000. Yeah, okay, this is
Yeah.
the breakdown based on this county. So we have a potential, yep, right there. So the estimated maximum award is approximately $500,000. So that's why I can't go beyond 6 people. So we are going to split this amongst our 6 companies, right? And the prime will get more. Now, this is what we do. This day is going to be recruitment day. Whomever wants to join in is a first come, first serve, right? Like I said, we only have 6 slot open. If you want to join in, then, well, I'm gonna say 5 more because myself and the prime are already automatically added to this opportunity. So we have 5 more slots for any agencies that wants to collaborate. And one of the questions that I get is, I'm not in South Carolina. How can I benefit from this? We've identified that you don't have to be in the States to qualify or to do work with us, right? We have different components to this project. We have data analysis, we have navigation, we have training, we have scheduling, different components, right? And of course, testing. So that's how you can integrate into this process. My recommendation is at least have an LLC, have a business, right? Then every other thing we can definitely work with. The deadline for this opportunity is in 2 weeks. It's in March, I think March 16th, I want to believe. Then, so that's for the RFP, the reactive one. So we are responding. So we are limited and we are working with time. The second opportunity is the multi-million dollar opportunity. Each company will be getting $1 million, $100,000. We can do 10 people on that slot. Benzie and I, we've taken 2 slots, 8 more left. Each company will be getting a million, oh gosh, $100,000, right? Then, so because we are going to be 10 in that collaboration, that means we're going to have 10 funders. So that means we are working with $10 million. If God allows us, so that's why I always like to spread my tentacles, right? 10 people, 10 states, 10 funders in all states. And we pitch across all states. So say for example, I have someone in Florida, in Detroit, in Alabama. We identify funders in each state. So the more the merrier for us. But the minimum is $100,000, then potential to increase to $10 million. So that would be the proactive opportunity that we have. So we're gonna let you guys ask your question because I always love for my students to make informed decision on which opportunity that you want to that you are interested in. Right? This is all of the work is taken from you. It's a done for you. All we need is after you apply to this opportunity, we move you to the next level. The next level looks like little group, little meetings here and there. I know some of you have seen that. Some of you have already collaborated on different projects with us. So we always have our little group. We have a team lead that helps us to facilitate all this process. So you get to, have networking experience at the upper level. So this is just the general level. We also have an upper level where we are in our little circle and we're just talking about numbers and just working on our labs and just helping our labs to grow. Because you can't run a business without money, without funding. So we are always spreading and looking for opportunities. So if you are interested, because I know it's the festive year, it's just a brand new year, my numbers are drastically low. This typical RFP is more greater than $2,000 when we do help you because it's a done for you. But because, like I said, it's the new year, we've brought down our price. So if you want to do just the RFP, which is the reactive opportunity, is $575. This is a great investment to position yourself for a $2 million opportunity and also relationship building opportunity because that's what your business needs, right? And for the proactive, which is the HIV multi-million dollar project, it's gonna be 675, right? Because we're giving you more money back, right? But if you want to take both offer tonight, it's going to be $1,000. If you don't take any of this offer today, tomorrow at this time in exactly 24 hours, this number is going to go back to its original price, which is $1,775 for the RFP, 2,775 for the HIV, and both projects are going to be $3,000. That's our typical cost. But because you're here tonight, you're spending out your hour with us, and because we want you to benefit from this, we are giving you this baseline. So we're going to open the floor for questions. I hope I wasn't too fast. All right, so I see Karen Cooper Baker will need the letter. I need Shika, I'm gonna ask you to take Karen Cooper's question.
Yeah, sure. Interested in option one, I believe.
That might be my question. Thought that was a number question. So Karen said, we'll need the letter. I would need information to set up because I am new to this and I'm a behavioral case manager for over 10 years. I have no idea how to set up or nor start this business. Okay, Karen, are you already in the diagnostic lab business or you're about to start? I know you're not paying this information out. What asking for me information want the cost? Okay, the cost, Karen, we just went over the cost. Also, Karen wants to know, I'm interested in option 1 and 2. I believe with my life experience and work experience makes me a good fit. Cool. We're going to determine that at the upper level because when we get to the second level, this is the first phase. The second, okay, you're about to start. Very well. So the upper level, it looks like who wants to do what? Then we start to, oh, $1 trillion is here. Hallelujah. All right, come off mute, come off mute, come off mute right now, right now. Go ahead and share your experience with what we're currently doing right now with the maternal health. Come off mute, my students, if you're
Hey,
in the
hey,
room.
hey, y'all. Hey, y'all. Well,
Yes.
I'm sitting in because we got, we got other things going on, me and Coach Eli. She knows we got other things going on, but I'm already in on another project, and I have to tell you, it's invaluable. It is invaluable simply because, and Benzie, kudos to you too. I see you, dear. I see you. They really take that, especially when that was my first project, group project, doing it with them. And they take so much weight off of you. Honestly, if you think to yourself, how am I ever going to make $100,000 in a shot? How am I ever going to by yourself? It takes a village to do such things. They already have done it. Why not walk with someone who has done it? Why not walk with someone who has that experience, who can lead you to it? Because I will tell you, she's not kidding. When she says once they submit it, they will show you the proposal. Like, they're not going to gatekeep. They will show you what they've submitted. They will show you everyone's credentials. Like, it is not, they're not gatekeeping. They will help you to be better. But you have to start somewhere because honestly, you can never do this by yourself. Honestly, I guess eventually you could, but it would take you a whole lot of time and a whole lot of money because there's not just doing it, it's connections. It's connections that they've already established with people that they're going to introduce you to. So that's what I'm talking about. That's what I mean. That's why this is worth the money, in all honesty. This is why it's more than just the proposal. Even if you never get anything, you got so much experience and what you can put on your resume, how you have been involved, what you've been involved with. Those other 10 people, I can guarantee you they will not be able to say that at this level. So that's what I have to say about that. It's worth every penny. And the price she's giving you, take it.
Absolutely. God bless you. Thank you so much. See, I didn't even know she's here, and that's what we do. The idea that you're working and rubbing feathers with Shika, Benzi, myself is just immaculate. And I had to do this even when I was trying to get to where I am today. And I'm not even satisfied. I'm not content. I still have bigger places to be at. But this is how you start. Never underestimate the power of collaboration. You don't even know who you're going to be in the room with. Like Trillion Dollars, let me tell you a little bit about her. She is a massage therapist. I don't know if you guys, some of you that were at the conference, she was our massage lady, giving us free massage. She's also a doula. She has a lot of experience, has worked with a lot of doctors, internists on the higher level. So again, collaboration just opens the next door. You don't know whom you're going to be in the room with. So if this is your chance to position your new business, LLC that you have not even gotten, this is your best shot. When they say invest in yourself, and I purposely am doing this. I purposely collaborated with the public health evangelist because I want to set my coaching apart. My mission as Coach Eli is to put $1 million back into you guys' bank account. And how I'm gonna do it is with this little idea of mine. So I think if I'm doing it, so every time when I say 10 slots, -1, because every opportunity I am there. I'm not, I'm, yeah, I got to position my business as well. So this is your moment to ask great question. I see a lot of students that has collaborated. Daviana is here. She's done a lot of couple project with us. Courtney is here. They've collaborated on different levels with us. So some students are here, and for them to be back here tonight speaks a lot of volume, right? We have a lot of repeat students. Takia is here. I can go on and on and on. I see all of you guys, but I want you guys to ask questions. You can't just not ask questions because you got to make informed decisions. All right. So thank you, $1 trillion. Thank you. And she literally just bought the lead testing class yesterday. And I told you to call me. You didn't call me because we're looking for a collaborative provider. So I was looking out for your call. Maybe you're gonna call me tomorrow. I'm not sure. But yeah, we work your this is your opportunity to work with Coach Eli, okay? For those of you that have been wanting to work with Coach Eli, this is your next level to work with Coach Eli.
I see we got a question in the chat. If the RFP is submitted and not won, the money is not refunded, correct? Also, what is the success rate of the RFP submission?
Good question. Shika, from your experience of submitting grants, what are the success rates? If you can just chime in on success rates.
Yeah, sure. Let's say for the first part of the question, yes, once the RFP is submitted, and if it is not won, the money is not refunded. But the success rate is anywhere between, I would say, 30 to 40%. But it also comes with the number of RFPs that we're submitting. So the more we submit, the likelihood of us winning the RFP is much higher, and the likelihood of winning the RFP with so many collaborators on board and having a strong coalition significantly increases. So that is where we position ourselves, that we want to submit a very strong RFP which is defended, and which, when the funders look at it, they're like, oh, this is such a strong coalition, and we want to give them money because the rest of the RFPs that we have don't have such strong coalitions. So that's what we are going to be positioning ourselves at.
And then let me also
Benzie, do you want to add
add,
it?
yeah, I do. I do. Yeah, definitely what Sheikah said, that this is definitely going to increase our likelihood, increase the likelihood. By yourself, yeah, 10, maybe 20%, maybe 10, 20%. But this is why we're increasing the likelihood by getting these collaborators. And also, I would say this with the multi-million-dollar approach. I just got off the phone with someone that sits on the board of a huge foundation. They have money available each year, billions, trillions of dollars, millions of dollars each year to give to different businesses. Do you know what they told me? They told me, hey, we want collaborations. We want people to come to us with projects in place so we can get the work done. So with this is more of in terms of success rate, I would say there's a strong likelihood, because the thing is, you already have a program. You already have a program in place. I would say our success rate has been at least 70 to 80%, simply because we have the funders in place. We have a huge database of funders that are already giving money in these areas. And we know how to essentially have conversations with these funders. We have been trained. We are trained facilitators, trained collaborators. So we know how to speak the lingo of those funders in those areas. And the thing is, I would also say this is a long game in terms of the multi-million dollar. It increases your likelihood of getting, but guess what? Again, you might not have one funder might say no, but this is why we have the other 9 funders. This is why they might tell you no the first time, but guess what? If when there's another HIV outbreak, even though you might have gotten 10 no's, just know you already have a proposal in place. You have a conversation with your city direct, with your county executive or your public health department. Let them know, hey, we have this proposal in place. Can we talk about addressing this HIV outbreak? Guess what? Even though you got in no the first time, you already have a full $1 million program that you can then approach. I'm even gonna say this. Yeah, you have the program that you can pitch, but guess what? There's always going to be an outbreak. We saw it with COVID-19. The amount of millionaires that were positioned because they already had a program in place. They said, "Yeah, we're going to do rapid testing. We're going to do COVID education, COVID screenings." So this is really just the same place where we're essentially you're going to have a proposal in place. So whether you win or not with the RFP, or whether you get the first no, you gotta be relentless. So we're going to handle the pitching on your behalf for one funder, but just know you're going to have to put yourself in the game and reach out to people because we can only do one, maybe only one funder. But if you know someone that's in your area, you have your friend that's working at the county or working at the state, talk to them about what you're doing. Go on your Instagram live. Talk about the collab. I just joined the Coach Eli collaboration on HIV. I'm looking to do HIV testing in South Carolina or HIV in my area. Who can I talk to? Hey, who wants to collaborate so we can make sure we do testing in our local city area together? So just know this is going to best position you for impact over the years.
Great response. Yes, Benzi is bringing lots of years of experience. We're not doing. We didn't just start doing this today, and I don't know why Benzi you didn't show them just to prove what we are saying. Because sometimes people can say all these things, but because of time, we have this database that we use. That's just a cheat way. I'm just gonna let you guys know. We don't talk because we feel like it. We actually know where these top dollars are, and we know who is about to give this money, like in a second. That's another reason why you truly want to just give it a shot. Take a bet on yourself. I'm never gonna come here and lie to you. Everything is guaranteed. But what I'm gonna tell you is that we know what we are doing, and we know where these top dollars are, and we know what to be talking about at the moment. This is just one way. So that's one database right there. And HIV is so pertinent. Yep, that's how much right there. So that's the funding database for 2026. We know who to talk to, we know what to talk to, and we know how to talk to these people. So, and this is the approach right here. You can't do it alone. Don't even deceive yourself. So
Yep.
last year, as of last 2 months, we know to be talking about maternal health because that's where the money is moving. This time around, since there is an RFP for HIV, we are reacting, right? We know to leverage. So I see a lot of questions. I'm gonna take my time. Isaka is saying syphilis. Um, I don't know. Is Courtney or Daviona willing to share? I don't do syphilis. Is it something we can do rapidly? Or even Isaka, if you can go off mute just to give us a little bit of insight. I don't know about syphilis. Unless if you tell me it's rapid and I can look into it. Is syphilis a rapid test? Daviona, Courtney, anyone? Even you, Isaka. Isakir, sorry. Isakir.
I'm not up to date with the testing for syphilis. It's been over 10 years since I've like
I don't
tested
think
somebody for that.
I don't think it's a rapid for syphilis.
Yeah,
I don't I think it's a RPR. I don't think there's a rapid for it.
yeah.
I can look more into it, but there is a rapid for syphilis. I can look more into it and report next time, but there is.
If it's not gonna cost us too much, because remember we have to make profit from these things too. I know there's a lot of resources on HIV, so I'm leaning towards, and thank God that HIV is the required testing. They are not requiring syphilis. So I want to
Okay.
just, yeah, they only require us to do HIV testing.
Okay.
And
I'll go with whatever you're going for, but I'm a medical lab scientist. I know there is one, but as far as mon monetary value, I don't know. I can look more into it.
yeah, for this one, guys, we're just going to go and we want to stay within our scope as well. I don't want to do something that is not within my scope. So it will be HIV and that capacity building. I feel like capacity building is interesting, and I'm looking forward to that one. If we get to our next level, that will be the first thing. So I'm saying this, don't take my spot, y'all. I'm going to be doing the capacity building. But yeah, those two. It's like I hope that helps. All right. I also see Muriel. How are you, Muriel? Muriel is asking, when is the class for HIV testing and lead? So this is not a class, but when you do decide to move forward, we are going to have a little group. It's a mini group based on whomever wants to join us. It's not a class, but we have meetings, periodic meetings where the first meeting has to be automated. That's to be by default. We got to take your information, ask questions, tell us what you're interested in doing and all that. We break it up. We break it some into the deeper level. I hope that helps, Miro. And Linda says, so my question is for someone just establishing in the industry, how can we utilize this opportunity for future collaborations? For sure. Basically, will this position us on a state? Yeah, this is on a federal level, especially the multi-million dollars. It will be based federal, it will be both federal and state level. And I think as a new business, this is your best opportunity to collaborate and start building relationships and start talking about because by just, let me tell you something. I don't know if you guys know that business is psychology. I was able to secure $3.8 billion in billion thousand dollars in contracts as a new business. I didn't even walk into that opportunity with any experience. I was able to get that money because business is psychology. All you have to do is say something that makes you look sophisticated. The idea that you have all these names, all these numbers, all this collaboration that you can leverage. Life is all about leveraging. So, Linda, I'm going to cut my answer short. You are going to be benefiting from leveraging and collaboration. Yes, even if we don't win, because I'm not going to come here and tell you that we are going to win anything, but you are positioning yourself for opportunity and more opportunities, if that helps. All right, we have one on board. Josephine, I sent you a PM, Sierra. I know Sierra is going to get on this one. Let me tell you guys something. Sierra is on all projects, okay? And things are coming in pipeline. That's how you position
There.
yourself.
And then let me also say this right now. Like, so with this opportunity is it will also give you the chance to be able to work with different MCOs. So depending on the funder, we can also pitch to different MCOs in your state. So that way, let me just put it like this: while you're still attending your weekly calls, getting your clients come in, doing your testing, we're working for you on the back end. We're working for you, handling this for you on the back end. So even if you don't hear anything within the first week, second week, the first month, 2 months, just know when the money drops, you will get a call letting you know that hey, the state wants to have a meeting with you. Your funder that we identify wants to have a meeting with you. Let's talk about the money. So let me actually go. So y'all show y'all an example of what a proposal looks like real quick. Since it might be okay, what am I going to get? So with this, here is the actual presentation for one of our chronic diseases that we worked with. The whole proposal, executive summary, introduction, company overview, etc. Blah 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 blah. A whole proposal, budget, everything included. So just know we have everything in place for you. So just know while you're still building on your lab, while you're still developing, is we're working for you so you can be able to amplify your impact on the back end.
Yes. And I don't know if $1 trillion is here. But remember, for those of you that purchased the lead testing, I told you about the MCOs, right? Benzi and his team are able and willing to work with you. Like I said, $300. Remember, that's what I said on the live. Whenever you've identified your MCO, just come. You have to come speedily. This is our expertise. We work with MCOs and we know they have money. I don't know if you guys know. MCOs are by law required to reinvest 3 to 7% of their profit. By law, they have to give the money back. They can't keep it. They can't do it the way they want it. They have to put it back in community and preventative screening, such as lead testing, such as HIV testing. Are you guys following me? So we know these MCOs. We've built relationships. I don't know, Benzi, am I able to mention some names? At the ecosystem level, 3 people have secured back-to-back contract money because MCOs, if you calculate their 7% investment profit, is close to $20,000 billion. So they have a lot of money. So there is no way we are taking ourselves to these MCOs and say, hey, MCO, we have this and this and this opportunity. Are you able to at least give us $100,000? They might say yes because we know the word. We know they have the money. Is it making sense to you? So $300, this is for you. If I know you because you're working on your project, I know you're very hands-on. If you ever need assistance with the MCO, you know to reach me. You know to come back to me because that's my go-to. I love them so much. They are the ones that gave us the money for lead testing. They have the money. And HIV is another preventative screening. If people are not testing, don't you know we are at risk? Our communities are at risk. And that's why when you test, we are by law required to report back this positive test and immediately treat. You can't just say, oh, you are positive. You got to treat these people. I hope you guys are understanding and following me. Yes, when it comes to MCO business, I'm interested. Just come to me. So guys, let me check. When I check this opportunity, we don't have enough slot left. People are actually checking and buying these things right now. After today, the opportunity is definitely going to go away. So for those of you that have purchased, we are going to reach out to you and tell you about the next steps. Okay. This opportunity is basically, can you project the prices again? The links are already in the comments. Just let me know which link you want. If you take both projects, is $1,000. I don't think $1,000 is typically both are $3,000. But if you don't jump on this opportunity, but I'm gonna let you know because we are almost sold out. And if you don't jump on this opportunity, it's going to be, you're going to have to wait for the next one. We're always going after funding. My goal this year is to go over $1 billion. So we've done the maternal health. We are doing this one. So it's a lot of project coming, but we can't take everyone. It's not going to be for everyone. And I'm glad this is grant. At least there is money set aside for this. So I personally think if you don't even want to do anything, you should do the grant because South Carolina is asking, and there is a multiple award. So they are not just giving one person. So the $2 million is across for 10 agencies. And if we go with this approach, with this collaborative approach, we have a better position. We have a better chance. And I would put my $500 on such an opportunity. That's what I would do if you were to ask me. So Ashley, is that you that you said you're at the prime for? Is that you, the same Ashley for the South Carolina? Perfect. So God is so good. We've already identified a prime, so we don't even have to keep looking back. Ashley is going to be the prime. They have their clear waiver, so they meet all of the requirements. So we are ready to roll. So it's on you because Ashley and I, and let me check. We going. We're going after this money. And it's not even from me. I know some of you are in the group. It's the government con group on Facebook. The lady dropped it. I'm like, what? HIV? I'm doing this. I'm bringing this to my group. And that's exactly what I did. This is actually not coming from me. It was from a random Facebook group on Facebook. So yeah, that's what we're doing. So definitely. So do you want to do the RFP for your state, Ashley, or both? Which link are you needing? Let me check if I have any more slots. Second. Yep. They're taking all of the South Carolina RFP, y'all. All right. States. All right. This is your state. Ashley, I need you to be on this one because you're my prime. Go ahead and get that. That's the state right there. Yeah, just do the state. I need you for the state. You're welcome. I see Open Road. Who is Open Road? That name keeps coming back. Ciara says she's talking to me. Let me see, Ciara. Sarah, where should I check? Okay,
It's in the, do you see it now?
yes, I
It's
see.
in the Zoom chat. I was just saying if you could talk for a few minutes after this.
Okay, cool. All right, thank you, Benzi. All right, Courtney, I see your messages. All right, I see a lot of private messages here. I didn't even realize it.
All right, y'all. If you do have any questions, please let Coach Eli know. I'll be dropping off, so she'll communicate with me. So just let me know if y'all have any questions or need anything, and then she will communicate with me. So uh, again, this is an investment to scale your business. So just keep that in mind as you go, and I'm excited to work with you all.
Thank you,
Thank you,
Benzie.
Benzi.
All
Thank
right, no
you.
problem.
Benzi left us, y'all. So we here. Let me see. I am gonna give you guys additional. Oh, it's 7:40. Okay. I'm gonna give you guys till 8 o'clock. So we can go off topic at this point. I know some of you are so brand new. If I were, thank you, Shika. Shika also has to leave. Shika and Benzi are a team. Okay, thank you, Shika. So this is all Coach Eli's. If you guys have any question, I have 20 minutes. I can definitely spare and talk off topic. It doesn't have to be this RFP. If you guys have any question that you need me to touch on, especially if you're new in the industry or if you're already in the industry and you're just looking for something, any help, let me know. I'm here to support you guys. Hey, Trillion, go ahead.
So Wednesday. I'm gonna call you on Wednesday. Is that okay?
Yes. Okay. Before when? What time? Because Dr.
No,
Juliet, I
before
think
that.
she's. Call me before that. Don't call me
Yes.
tomorrow because I have to teach tomorrow. But yeah, call me in the morning on Wednesday. I'm free.
Okay. Because I'm gonna be on that meeting too.
Yes. Oh yeah,
Yeah.
that one, y'all. You should not miss that one for sure. Yeah, Shika is looking for can a new phlebotomist even just purchase. Let me check because I'm gonna have to deactivate the link because I want to keep, especially the RFP one, I want to keep to 6 people, but the multi-million dollars we can do 10 for that one. Because you already know South Carolina it wasn't from me, it was from the B group. So we have to really, really go in there with strong foot forward. Josephine, yes, you can call me back later. Welcome C3 Ultra said, can a new phlebotomist take? Yes, you are a phlebotomist. You can do this for sure. So what is needed for this? You just need an LLC. Just go to your Secretary of State and get your LLC. That's all that I need. And if you already have an existing LLC, you can use this. Remember, this is collaborative. The prime is the most important person, important company, and that's Ashley. Ashley, do you want to come off mute? Do you want to show us so we can see who you are? Just so we can know who we are doing business with. Well, we're definitely gonna do that at the upper level. But if you're not shy, just come on. Let's see who you
Give
are.
me 1 second. I was working. Hold on. Let me flip my camera. Uh, how can I? Okay, here we go. Hello.
Yay. Are you excited?
I'm excited. I'm ready.
Anything about your state? Did you see those little counties? Are you familiar with those
Yes,
counties? Which one are
for all
you?
the
Any all
surrounding.
those?
I'm in
Okay,
Florence, so I was in the middle part.
the middle part. Okay.
But
And do
I
you know about
service
this?
all the little areas around already.
You already do it. Wow. What do you
Yes.
guys do?
So we provide drug test and phlebotomy services and the whole 9 yards of the laboratory, and
Mhm.
mobile as well.
Do you guys have CLEA?
Yes.
Are you guys CLEA waived? Okay. Perfect. Perfect. All right. Cool,
Yeah,
cool,
through
cool.
Clear Wave.
Awesome. I'm excited. Thank you
Yes.
so much. But yeah, nothing to
Yes.
worry.
You know.
When we do get this money, you are going to get, we're going to talk about this in the at the upper
Okay.
level. You get more for sure. Yes. All right. Thank you. You
Okay.
already heard me,
Thank you.
y'all. Welcome. Coach Eli, can you do a Zoom on your classes and where the newbie should start based on your experience and the need of economy? Oh my gosh. Based on your experience and the needs of economy. I think for newbies, y'all should be doing basic drug testing and DNA. Those are, you don't need to draw blood or anything. But if you have the skill set as a phlebotomist, I want you to add that. That should be your third service or list of services. So drug testing, you can become a DOT specimen collector as early as within a day, right? Without breaking the bank. I even have this upcoming sales. The class is going to be $99 if you want to wait to the end of the month. I'm having a sales coming up so soon. So that's $99. So speaking of economy, that's how you can save money, right? Then Ebony. Yeah, Ebony, does that help take care of your question? Yes, I can just purchase. Let me check. I'm gonna have to deactivate that thing right away. Hmm. Some people are actually doing both. So that's 2, 4. All right, I have one more slot for the clear for the South Carolina. One more slot for the South Carolina. Where were we? So this is the thing right here. So Sheila, the class for the $99 is going to be the DOT specimen collector. And you can do that and work for, let me tell you one secret, y'all. There's a lot of franchises right now looking for mobile collectors. It's a lot of contract right now. Every new year, businesses are growing and expanding. Every new year, something new must happen. And it's definitely has to do with growth. So a lot of people are expanding their services. A lot of businesses are starting, like you guys all are going to start new LLC. So opportunities are there. And it's the same thing at the corporate level, at every asset, every facet of businesses. So you can position yourself as a DOT specimen collector. If you're not good with marketing, offering DOT or drug testing as a service allows you to receive jobs and get paid, if that makes sense. So Ebony and Sheila, I hope that helps. And the class is going to be $99. So if you are expanding, this is the time that you can buy one for your staff member, for your child, for your spouse, because you can never tell when you guys are going to get a contract. Contract opportunity will always be there. It just depends on which one are you positioning yourself for. Opportunity is a lot. As long as we have human beings, as long as it is in healthcare, there is always a need. There is always a need. MCOs alone should be your best friend. If I were you, if you have not learned anything in tonight's call, you should have learned what an MCO is. MCOs has money. And we know, Coach Eli, have known to build relationship. MCOs alone can feed me and give me generation wealth. I don't need to look elsewhere. A lot of people don't even know about MCOs. All they know is trucking company, security company. I know to only do business with MCOs. So if the only thing I know how to do best is to work with MCOs because they have the money. They are by law. It's like vaccine. Children are by law required to be vaccinated. By law, every child needs to be let tested before they turn 2. So I know some certain things that can put food on my table. I don't need to work hard, but smart. And in order for me to work smart, I purposely joined this ecosystem. And that's where I met Benzi. In our ecosystem, what we do is MCO. Our life is all about MCO. MCO is our best friend. And to even make it more interesting and more factual, in each state, there are up to 20 MCOs because MCOs are also, they're, I don't know if, yeah, so that's a great question. So let's go back to what is MCO. MCOs are managed care organization. They are managing health insurances, different plans like Athena. Give me those names of insurance companies in your state that are Medicare. Those companies, they fight to have the best, like nursing homes. Is they're all in business. MCOs are also in business. So the more they make, the better. So they all receive their money from government. It's a fund, it's a government funded program. Yeah, like United Health. They all have the money. So if you have not learned anything today, I don't care if you don't buy anything. At least you know that Chochila told you this and you can run away with it. MCOs gives a lot of money. Blue Cross Blue, that's right. That's it. Sheila, right there. Etina. Those people are the people you want to learn how to do. They will give you, even if it's $50,000. Okay, you're talking about HIV. You talk too much. Okay, just take this $10,000. Just go and do something for the community and just show. Well, here, as long as you can show and document, and anytime, let me give you one hint. Anytime you're proposing something to MCO, always include public health education. They want to see that community integration. They will give you money. Even if it's not a lot, they will give you something. And that's a foot in the door. That is a foot in the door. You want to. And if you don't know how, come to me. That's how I enjoy working with MCOs. That's actually what made me pay $20,000 to join the ecosystem. Benzie and I paid this money. That's how we met and we became strong collaborators today. And we've been impacting lives. And more is to come. So we know anytime there is an RFP, we know to always also proactively. Public health is not, no, you won't say public health. You're just going to say anything community health. I don't care if you want to give them free book, free anything for the community. Just put the community into your conversation because that's what the money is for. Community integration, right? And start talking to these MCOs. If you don't know how, we can help you. So it doesn't even, you don't have to collaborate on what I'm doing, but you have to learn to position your labs for this success. There is a lot of money. I'm telling you, as you can see, I don't know if you guys saw Benzi's screen. There is money moving. Just 2026 alone. Look at that much that is available. $3 billion. And you are in healthcare, you're testing, and you have not gotten a dollar. That's not good. That's not good. And that's why these meetings are important. Don't need to be positioning yourself. And I will never come here and be greedy. That's why I'm asking you to pay $500. You think $500 is what you need for somebody to just do something for you? Don't you eat food? Don't you eat out for $500? This is a done for you. You don't even need to do nothing. Just give us your business name and Benzi will do it. You think is because I don't want to do it. That's why I'm also partnered with Benzi. So $500 is just typically I could have said 2,000 and it would have still justify what I'm still doing for you. But I'm not because I want everyone to benefit. $1 trillion. I see your hands up.
I just wanted to say for the new people that are here and have really never dealt with Coach Eli before, I am here to tell you that everything she's saying is absolutely true. She will take a phone call from you if needed. Like she doesn't gatekeep. Like even though she has made all this money, she doesn't put herself above you. Like she will actually help you with whatever it is that you bought from her. Like I don't know how much we've been together. You know, lead testing. I've driven. I'm in Pennsylvania. I've driven to Georgia. Like whatever you need to do in this business, like she's going to help you if she possibly can. And if she can't help you, she'll point you to someone else who will help you because she has those resources. So if you're having any doubt in who is this, like she will get you in the right direction. Don't think that you're investing your money on someone who's going to leave you. You know, you invest your money, oh, it doesn't work out, and then they walk away because you know that exists. She's not going to do that for you. She will be there on every project, on everything that she says, she's going to do it. I'm here to tell you.
Thank you. Thank you so much. God bless you. Because you might as well not say anything and it's not going to take anything away from you. But the fact is that I have conscience. I'm not going to, if you call me, even strangers, I talk to strangers, people that have not even done anything with me, that's not even paid me a dime. talk more of you guys that are investing and we're working together. Yeah, I would do exactly. We do what we say we're gonna do. That's just the truth. And immediately, for those of you that have paid, you're gonna start to by tomorrow. I can't even let weekend come. I will start putting us all in groups together. We work and we've done different projects. We've done different projects, and like I said, if this doesn't work, wait to the next one. There are going to be multiple because we are going to whatever it takes is what I want to give. And I don't know if you guys have seen what is her name? Nafia is also another one that George, and I shared that video. Nafia, I'm sure she's gonna buy this one too. Everything we do, and look, doors have been opening for her just because now she has learned from me. I don't know if you guys saw whatever in Texas, that was from Nafia. She had to go anonymously to post that in the group. She's expanding now. Now she's looking for people to subcontract to. That's the type of opportunity that you are signing your agreement to tonight. Because you don't know until you know, right? So these are the type of space that will bring some information to you. At least I'm glad that I told you about MCO tonight. There are some things, and like Trillion Dollar say, if I don't know, I have people. I know people. I'm a college professor. I work at the oldest HBCU here. I know people. I know resources. I know some things. So if I don't, and I would never go and position myself for what I don't like. The syphilis, I was honest with it. I don't know about syphilis, and I don't want to do syphilis because I don't know what it is. But I know I've done HIV. I've done all this other rapid testing. I can close my eyes and tell you what I need to tell you. Like, what are the protocols for STD? We need to report it. We need to treat it. I know those things. I can do it, but I'm not gonna do what I don't know. You see? So just here for you guys, right? Let me see if I have no questions. And it doesn't, like I said, you don't need to ask me anything so that is not related or that is related. So you have a pitch we can buy. Yes, that's a very powerful question. Yes, we have a page we can buy. We can, yeah, it's just I sell so many things or I do so many things, but that MCO is what I want to introduce a lot more in the industry because a lot of people, all they teach us is DOT certificate, and I want to change those topics. I'm just tired of those things that don't even bring in money. I want to start to change, and that's why you have to be in my group because I'm going to be moving healthcare in a different direction this year. So yes, MCOs will be our topic of the year. You're going to hear me talk a lot more about MCOs. And yes, if I have to throw a class on just MCOs, but yeah, to answer your question, welcome. We have like that's what Benzi does now. We know a lot, and you don't. It's just Benzi that you met, right? We have a bigger ecosystem, and we have quite a few people in that space as well. But yeah, we have ready-made pitch, we have ready-made programs, and we know these programs are good because a lot of agencies have bought and are using them. So yeah, that's a great question. I actually like that you said that. You're reading my mind. Whomever that person is, that's my goal for you guys in 2026 to start to introduce things that really matters, the healthcare space. Because let me tell you something, all these doctors that are working, treating, and all this, there is no treatment or there is no healthcare without the lab, without testing. You got to test people first. So why don't you think big and write yourself into a transaction? That's how you have to start. See, even you guys that are phlebotomists, you think phlebotomy is just phlebotomist, right? I'm glad that Vienna turned on the camera so y'all can see she's agreeing with what I'm saying because she's a physician. I mean, I'm gonna let you talk because you gotta talk to these people. You gotta talk to these people because they don't know. You better talk to us because you're a doctor. So what you got
No,
for
I
us?
just I just dropped it in the chat and I'm just blessed to have been introduced to you. Like I've came across your content on Facebook from couple months ago, and I'm just happy I made that decision to connect with you because even though I've been a practicing provider for almost 10 years, you've just opened up the doors to so many new opportunities. As providers, we only think one way, but like you say, diagnostics is at the forefront, and that's what we use to treat. Without the labs, without the diagnostics, we can't treat, we can't educate, and we can't prevent. So if you guys are thinking about joining her team, definitely don't second guess. You have to invest in yourself. It's worth it.
Yeah. And Daviana she took my class. She was actually one of my students. She was on the second to the last score last year. She has a lab. She's a doctor. So for a doctor to even say, Coach Eli, work with me, that speaks a lot. I'm proud of myself. I don't care what y'all think, okay? Davina is a doctor. I'm always proud of her. Even Courtney. I don't know if Courtney is still here. They all know how I feel about them. I don't underestimate. I don't care if I'm Coach Eli, but when I see people that has their head on their shoulder, I want to rub feathers with them too. That's why I always give a shout out. Daviana is there. Courtney, you still in the room? Courtney is a nurse practitioner. She has her own clinic. She makes money every day. But anything Coachella is doing, you're gonna see Courtney. She's gonna come and support me, just because we know what we're doing. We're not here to, and I will try my best because the way people are teaching people is just annoying. I'm not saying I know it all, or I'm not saying I can give you the result like today, but I can tell you I know something. I know a little bit of something. And you guys, phlebotomists, I don't care. You have to carry yourself. You got to understand. Like Davina said, you can't prevent, you can't treat, you can't do anything without you first. And look at you, you are the underpaid. You don't even know what you're doing because no one is teaching you. So that's what Coachella brand is for, to even break that barrier. And we're gonna continue to have these meetings and this opportunity. You don't have to do today, but come back. Anytime I say come to class, I always say you will learn something. We're not gonna be wasting. My kids are downstairs waiting for me to feed them. You think I'm gonna be wasting my time here because I needed to? I'm already sold out. Don't think I'm still waiting for you to buy anything. I sold out already. You want to see my screen? But this is to tell you that I have passion. And I know that there has to be a difference. Something got to happen. The way you guys are being taught, the way they're telling you things is wrong. We're not doing that in 2026. I don't care. Whatever it takes me is what I want to do. And I'm not going to lose my relationship with Daviona. I'm not going to lose my relationship with Trilon. I'm not going to lose my relationship with Courtney. I'm not going to lose my relationship with some people because I can't do it alone. I need a village. I need them. I'm not gonna lose my relationship with people that I know that would help me get like Daviona. I had to immediately recognize to partner with her. Daviona is solving a lot of problems, a lot of gaps. Let me tell you, if you have I don't know if you guys worked with us on the Quest Diagnostic Project. That was the lady behind the whole thing, helping you guys connect you. Daviona is only has multiple lines or multiple, what is it called, multiple states, to she can treat in multiple states. But she said, Coach Eli, don't worry, bring all the students. Let me tell you what this lady is doing behind the scene. She is helping me to help you guys connect you to any provider in your state. Who does that in the industry? How much are you giving us? In this particular collaboration, we only paying Davina $50. $50. Some of you will buy Chinese food for $50. Chinese food. Oh, Sierra is stating Sierra is in the comment section. So y'all would think someone is here to make. I don't care about your money. I don't care about what you want to give me. I'm a college professor. I make money. I have my lab. I have my contract. I'm only just here to show you. So Davina here, she's working with a lot of students. Some of you are in the comments acknowledging that I'm telling you the truth. A whole physician who has their practice working with Coach Eli to help you. Think we are here to play? It's on you. So you might as well want to go those small route. But we are here to make money. We are here to build wealth. And that's what we're gonna do in 2026. So whatever it takes. I don't know it all. I've not figured it out. But when I see my people, I'm loyal. I'm loyal. I'm loyal. I'm just there. I'm just there. So yeah, this is HIV. We're talking about it. We've done HIV. I'm surprised there South Carolina is giving some money. We've been done this in Atlanta. Courtney was part of that project, as a matter of fact. Where is Courtney? We've done these things. We've done these things. So, y'all, all I'm just saying for those of you that are still on the call, always show up. Oh, yeah, yeah, Davina giving you roses right there. Yeah, Davina always shows up. Anytime you call her, you call us, we're gonna answer. Davina got the mission on day one. If I call Davina tonight, she say less, Dr. Elizabeth. Say less, and she's gonna help my student. She helps me a lot. You don't have to be nothing, Norman. You don't have to be no nurse because we collaborate with people. Daviana is there to collaborate with. Courtney is there. You don't have to be these people. Just collaborate with them. That's all. Yeah. Daviana, have you gotten your physical examination license for the DOT? Because somebody wants to collaborate here. I think she's talking about the DOT physicals. Is that what you're talking about, Linda?
Linda? I missed her comment. Yeah, I passed my exam for the DOT physicals.
Yeah, that's it right there. Okay. So we're gonna have to brag about that. So we're doing DOT physical now, y'all. I don't care about what y'all think. But look, that's why people are hating. They started calling me scammer because they don't even they don't know what else to do. And God brings these people to my team. Daviana was just a student. She just signed up. And since then we've been collaborating, we've been bridging gaps. Look, we're gonna have to go show out tonight. I want to go. I want to go. I want to go announce this news. So we already have it. Look, you might as well stay there or come with me because we got work to do. Yeah, Davina, and the funniest thing, she doesn't even charge. I'm like, Davina, she doesn't even charge. It's like she's like, Coach, like, what am I? Davina, charge them your fees. You're a doctor. You've gone to school for years. Like they need you. I'm just happy and blessed, and I'm glad that you guys are here. All I just say is these calls are free. Come on, listen in and learn. If you're trying to get started, I have a lot of YouTube video you can slide in Daviona's. Like I have people that are there to support you. I couldn't do it alone. I know I can't do it alone. So I've 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 understood to work with serious people. Yeah, Dr. J is a new one too that I can't even wait for you guys to meet. Same process. Dr. J is now in my current class. Dr. J, you want to tell them a little bit about what happened yesterday and what is about to happen tomorrow? Dr. J, come off mute.
I'm sorry I would come off of this thing, but my dogs are, please forgive me. Can we just give a hands up and show appreciation for this? The our people say the connector's connector. That's who Coach Eli is. The connector's connector. Let me tell you something. Just even being around, do you see the energy that she brings to you? You can't buy that. You cannot buy that. It's not about intellect. It's about her passion to serve. It's about her ability to connect. And it's about her ability to meet people where they are. Man, I thank God for meeting this one. I've been following her quietly for almost a year, just watching. And I can tell you this about Dr. Eli. Let me give you your flowers. She is so pure-hearted in terms of her serving. She's continuously looking at how can I serve? How can I meet people where they are? How can I reach them? So it's just a pleasure to work with her in any capacity because she leads by example. She doesn't just talk the talk. She walks the walk. And sometimes for some of y'all, she's carrying you on her back and you don't even realize it. Do not play around with her. Okay. I'm just saying this, much love and respect. All right. You can pivot, you can grow. That's the thing I love about her. She shows you that you don't have to stay where you are. Whatever degree you have or don't have, you still can pivot. So, Dr. Eli, thank you. Thank you for what you do for real, honestly, because so many people, I didn't know you were at an HBCU, first of all, but yeah, I just learned that tonight. I'm always learning something. But I just love the fact that she is a woman of service, and that's why she stays blessed. The money flows, okay, where the energy goes. So as she's giving you her energy, of course, money has to come her way. You have to release to have your hand open to receive. So she's mastered that. So again, thank you, Dr. Eli, for all that you do. I have to tell you that. I just have to tell you that. Guys, meet us on Wednesday. Listen, we are about generational wealth. That is what Coach Eli is about, generational wealth. Catch this vision. Please don't miss it.
Thank you so much. God bless you. And I just feel like crying. This is not even the space yet. And like I said, God just dropped these people. I don't know Dr. J, but I know to be humble. And I know to discern. I know when to say yes and no. The moment this lady reached out, I didn't even have a doubt. Immediately, I connected with her. And look at what she's bringing to me. On Wednesday, y'all, this is part one. We are going to blow your mind on Wednesday. Dr. J is powerful. Yo, that's just one speech behind the scene right there. Come. People have been, God, this is God's mission. To break curses, to build wealth, you think is for the weak? You think devil wants you to get there? No. Devil don't want you to make money, to have peace. Devil is to destroy. So it takes some sort of supernatural power. And God has been positioning people. And this is just the beginning. And that's why I say you better start to position yourself. You better. Dr. J is, she can't wait for for tomorrow. When is Wednesday? Teaching you. She's I'm even coming to take note. I'm not even teaching Dr. J. Just so you know, you're gonna have to do all of that. Because we have to take notes when she's speaking. So I'm glad God is helping me because I can't do it alone. The vision is clear. I can tell you that right now. I know I have a vision and a mission. We got to the way like in healthcare, we're doing drug testing, phlebotomy, and we are still here not making money. No, it's impossible. And I will use everything I need or have to get us to our next level. We got to get to that place because we are doing a whole lot. And God will help me. God is going to help me. God is going to help me. Absolutely. Thank you all so much. I appreciate. I see the love, I see everything. But just know that it is not just me. I have a team of people that are supporting me. Some of them are here, tonight, and some of them are not. But I just want you to hang on and stay tight. And also pray. Pray over your businesses. Pray over your businesses. And when there is opportunity, always tap in. Always tap in. Okay? Norma, this is the fifth time. So I think I haven't covered the question. How to start? Can somebody who have started really help answer that question? Maybe I'm answering it from the coach perspective. Do we have like a real life experience? Is anyone willing to share? Like, how did you guys get started? How did you guys start? Who is willing to share? Ryan, have you started your business?
Yes, I have. Like I have an LLC. I just got, oh, let me step outside. A brick and mortar. So now I'm trying to be like have like a brick and mortar and be like mobile at the same time, or look for people, you know, like staff wise or as needed.
Yes, needed.
Oh
Absolutely.
yeah, and I have my CLIA. I got approved for it, so I have the CLIA number. I just don't have the paper yet. It's being mailed to me. But yeah.
Absolutely. Yeah, that's how you grow. Don't have to
Yeah.
have anything. This industry allows you to start everything from scratch.
The crazy part was like I was in medical field for over a decade. Then I transferred to transportation, thinking I could do something different, and that's been up and
You want to
down.
bring out
Yeah.
sneakers? Those sneakers.
So then I just like I still have my certifications. I mean, put them to use. I seen your page and I seen another lady's page. I was like, I might as well do what I've been doing and profit more and be able to help the community by being able to expand and do more. So that you inspired me to do it, and now I just want to keep growing. So thank you.
Yeah, thank you. We're gonna do it, and I want to do it differently. I don't want to do it. I don't want you guys to start and not make money. So my head is always spinning, and I think this approach is the best way. We just have to leverage healthcare and leverage our experiences. And I have a master plan, and I think we will do it. It's doable. Thank you, Ryan. Easy Pricks, I see that you came off mute. Were you gonna share something?
No, I actually wanted to ask, okay, so I'm doing mobile for money, but I'm just getting into the DOT and you know, um I joined your class and your platforms, and so there's a lot of opportunity there. But if you're at a place where you don't have the funding to start the opportunities, like right now there's a big opportunity in place, but I don't have the funding right now. How do you put yourself in position if you don't have it?
Yeah, if you don't have it, I would say look for people that are willing to subcontract because a lot of times people can't even do the work alone. They are always needing people to sub it to. So that's another way to get in. You can tap in as a subcontractor. So you have to put it out there. I saw a lady today. Her name is Maddie. Maddie posted. So what she did was listed her expertise, her location, and said she's open to this. So you can do that too. People are looking. We have over 13,000 people in that group. It's one of the fastest growing in the industry. So you can market yourself that way and also show up. I see that I think this is your second time that I've seen you on this type of call. So continue to show up.
Okay. All right.
Yeah.
Thank you. And then also, if opportunity, I'm sorry, because I did get a opportunity for RFP, and it was for drug testing. And I just did the class, and I was like, okay, this is a big opportunity. But I already knew that the capacity that they want me to, I just started. I just did, and it's in a whole different state, but I'm willing to travel. So when I saw the amount that they were asking and I was, I guess, looking to figure out like how to do this, like what you're doing right now. So I'm guessing I'll just put it in the chat and just see if anyone's open to it.
You could do that, or you could solicit our help as well to leverage our community, whichever way you want to do. That's
So
why the community is there.
I'll write you and then I'll get, because I don't think I have your number, and then I'll communicate with you and just let you know what it is and see how we can move from there.
That's exactly what the lady did. There was a lead RFP in New York that was 3 months ago. She couldn't do it alone, and she knew I had this lead experience. So she reached out to me, and we did it the same way. Because
Okay.
we've seen, like Benzi said, CDC, that's what a lot of funders are looking for. They don't want you to be they won't give you the money if you're just by yourself. That's the truth. So
Yeah.
they would rather you come in numbers and, it's more reputable. It's more trusting for them. They would rather
Yeah.
do it that way.
Okay.
Yeah. All right. Isaka, I like that you're bringing this, and I see a lot of people that are interested. This has to go by Daviona if she's willing to do it. So, a lot of people have been reaching out to me about the Quest Lab account. So, if you are interested in the Quest Lab account, you have to, Daviona, is this something that we still want to do?
Sorry, I missed it. I heard my name called. I was trying to respond to the chats on the side.
Oh, okay. So Isaac here, there is someone is Isaac here. They are asking about Quest Clinical Lab account. And I know we do that through you. Is it something you think we should open back up or just still wait a little bit, or you just want to do it on individual basis? Because Isaac here, what state are you in?
Florida.
Okay. So Davina, that would
Yep.
be your call.
Yeah, I'm gonna drop my email address in the chat. That way you guys can, because I have like four conversations on the side here going on. So let me just drop it in the general group chat. That way, and everybody who's interested, and that way I can give you some more guidance.
Yep. So that's the go-to person for that. All of your clinical needs. Yeah. You run it through Miss Daviana.
Hello, I have a question. Can
Hi.
you hear me? Hi.
Yes.
I signed up and I'm excited. I'm here in South Carolina, not too far from Ashley, your prime. But I got a question for about the quest. What if you are already like you got say like you partner with somebody that has a quest account? Is that like having your own, or should I do I need to get the Quest account for myself?
Daviana, you want me to answer that or?
Is the person you partnered with a provider?
No, they're like no, no ma'am. So that's what that's my well, you answered my question. No, they're
Okay.
not a provider. You answered my question. Thank you.
Okay.
Yeah. You need for the clinical lab accounts is good. I started teaching it because again, a lot of people don't know about it or they're not even doing it, or there was a barrier, which was a clinical provider. So that's where Daviana came in and started helping us, right? You would be able to open an account with Quest, which is a clinical lab account, and you can really use, because with the clinical lab account you don't only get supplies, but it gives you access to portal, access to physicians, and you can go into those nursing homes, you can go to doctor offices and get contract that way. But if you don't have the clinical lab account, you can't even get contract, you can't even talk to these people. So we use that as a means, but I do know a lot of us do not qualify. So that's where the partnership comes in play, right? So what are the qualifications for Quest? The qualification for Quest lab account is simply have having an NPI number, a clinical NPI number. So if you don't have a clinician's or a provider's NPI number, you would need to find someone who has the NPI number. Oh, past my time. Will you ask this beginning business credit? Business credit is not my forte, but again, I have the network. So yeah, we have people that can help you with your business credit. But honestly, the simple way is for you to just get a secure card. Like you can go to Home Depot, you can go on Amazon and get these business credit cards and spend and pay back, spend and pay back before you know it. But make sure these agencies can report back, will report your activities back to the credit bureau. And within 3 months, you have a business credit. It's just like your personal credit. Get the personal credit, you spend, you buy, and they report it back. So that's the easiest way, Sheila. Because with your business credit, you can set up labs account. Yeah, you need an EIN and LLC number to get that. Because most of these labs, especially for drug testing, the toxicology lab account, they require that you have a business credit. And if you don't have a business credit, that means your premium is going to be high. That means they're going to refer you to a TPA. And a TPA, they are expensive, but at least they still help you to get the lab account. But if you have your lab account, you can work with the lab directly. So yeah, an EIN number is the same thing as your social security number. So it's just a social security number for your business. And it's free on irs.gov. You can get an EIN number.
I have a question. Can you hear me?
Yes.
Okay. It seems like I'm just coming in the middle of your class and stuff, and I'm sorry about that. But it seems like one has to set up a business first. Um, they have to have a ENI and they have to have a NPI and they have to be a provider. Is that a
No.
provider? No?
You don't have to be, well, yes, a provider as your lab, as the business, not a clinical provider. Is that what your question is?
Like a provider, Medicaid provider through the state.
Yeah. Yes,
Okay,
you're right.
so I'm here in Ohio, so I would have to get a certification provider certification through Ohio State, to the state of Ohio.
Yes, if you want to
Okay,
do Medicaid, if you want to accept Medicaid. But some of these
okay.
services are cash based too. So you don't have to start the hardest way because that's actually should be your long-term goal. There is something we call the short term and the long term. So that will be
Mm-hmm.
your long-term goal. Your short term is just to get the LLC and EIN and keep it moving. Get your DOT, start making some money. And then when you're settled in, you're already making connections, you can start to plan of becoming a provider. That can, and it doesn't happen within 2 to 3 months. It just takes a minute. So you don't want to waste time waiting to become a provider.
Okay. So does this quest, what is this quest that you have to be a part of? Is that some other kind of certification one would need?
No, it's not a certification. It is just to help you get a lab account with Quest because we do clinical stuff that can also bring in money. Remember, it's all about what can bring in the money.
Right.
Right. So with the Quest lab account, you can work with doctor offices, nursing homes. And I
Mhm.
think what I would do, I'm getting inspired already. Dr. J, if you don't mind, you can be my accountability partner on this one. We are going to have, and even Daviana, and I will try to even what I'll do. God is just giving me inspiration. I just got a reminder right here, guys. What I would do is I'm gonna consult with my providers, some of my clinical providers that are my students, who are nurse practitioners, who are doctors, and we're gonna have a class, and we're gonna teach you on some of these things, which is to include, like somebody is asking a Medicaid class. We're gonna educate you on what Medicaid is. We're gonna educate you on the clear process. We're going to educate you on the lab accounts process. And I'm going to bring those as a panel and we're going to educate you. I think that's what I'm going to do. God just gave me that inspiration right now. And I think a lot of people would tune in. We might ask for money because I may want to compensate my speaker. I'm going to ask them if they say it should be free, we're going to have a free session and we just come and just pour into you guys, right? We're going to talk about all that clinical aspect. What are some process to get the NPI number? What is the clear process? What is the medical director process? What are those things? Some people don't know and some people don't, right? So we're gonna, I won't be the only speaker. I'm gonna bring people that are expert, right? Courtney has her clinic. She's down. I know she's gonna say yes. We just have to work the calendar, right? Daviana is gonna be on there, right? It will just be solely clinical and it will be those frequently asked questions, right? NPI, clear, provider, this, that, doctors. We're gonna do it. We're gonna make it happen. So that's the inspiration I get from these questions. So Dr. J, just please remind me because I have a lot of things and I might
I
just forget
got
that.
you. And I'm
Yeah,
even
we're gonna
thinking
do
that
that.
possibly even putting it together in a process for you that you
Okay.
have, so there's one and done and everyone has something. So yeah, definitely. I'll remember.
Yes, ma'am. And so I want to get on that inspiration. So we might make it a component of the conference because conference is coming up as well. Or we may just test run an online version to see if we can get more questions that we can tailor to the conference itself. So yeah, there are different dimensions to really educate people and empower people. So yeah, we would do this. We might first of all do it as a virtual option. I don't know. But I would definitely want to talk to my team first. Great question, guys. Yeah,
Okay.
because people just need these answers. Okay, go ahead, Jamitra.
Yes, it's Demetra. I have a question. I think I'm a little bit further along than what we're talking about. I'm at the Medicare application part. Because I was told I had to fill out a Medicare application before I could fill out a Medicaid application. Is that true?
Not true, but it makes the process easier. You don't have to. And we only say that because Medicare application is a little bit cumbersome than Medicaid. Medicare, you have to pay. Medicaid, you don't pay. And Medicaid is through your states. Medicare is federal. So I don't know if you're working with someone already, but you can do the Medicaid on your own and it is through your state. And that's what that Miss Jenkins. Oh, that was Norma. That was what Norma was asking. Just searching and trying to understand what the process is for your states. And that will be some of our topics to cover, the Medicare process
So,
too.
do you have anyone or do you help at this point with Medicare? I'm all the way at the end of the application. I'm kind of ready to submit. A little nervous, don't know if what I put on there is correct or anything. And I didn't see anything that was just specific to managed care organization slash applying for Medicare. So, are you going to have anything like that coming up, or what would you suggest I do? Like I said, I'm ready to hit submit, but I'm a little bit nervous just to make sure that I got everything that it needed to be included on there.
May have to take a look at the application because I don't know where you are with things. Or you can just give it a shot since you're already at the end. And if there is, but that might take you back because you might not be doing something. I don't know. But yeah, it will be something we would cover. I actually have it down, and Dr. J also is taking notes. We would have it as part of our topics to cover. But I don't know if that will be too late for you. But if you want, you can schedule a time with me and I can look at that just to make sure you're doing something right or wrong.
Okay, and how would I go about scheduling the time?
So you would go on my website. There is a section there that says consult, and you can book a time to speak with me on my website.
Okay.
Yes, ma'am. And the conference, we are looking at July or August. My speakers are giving me hard time. So I'm looking in between August and July. Or worst case, we just keep it at September. But there is a workshop coming up in exactly a month and a week in Maryland here. So if you want to come to Maryland to have your business startup, hands-on support, experiences, networking, you can definitely join me on the 28th of March next month. Otherwise, you can wait till our next conference. With your immigration niche class, is that part of the DNA class? So yeah, tomorrow, well, on Wednesday is the immigration class. And we're not going to talk about DNA because we want to keep it separate. But there is something we call immigration DNA, which I may touch a little bit on it since there is a question on it. But yeah, immigration niche is big on its own, so we can't just say it's only DNA. But we have a class on it on Wednesday. It's a free class. All right. So okay, how much for the next month meeting? The next month meeting, as we speak, is still at $675. On March 1st, it's gonna go back to its regular price of $800. So you want to get in now or yeah, it's next month.
I'm sorry, what is the price now?
It's $675. That's in Maryland for the in-person workshop. If you can't make it to Maryland, my next core mentorship has opened, and that will be for 5 weeks. Josephine is going to be there for sure. The class on Wednesday is 8 p.m. Central Time Zone, 7 p.m. Eastern Time Zone. So if you're in Atlanta, Maryland, it's going to be 7 p.m. It's going to be 8 p.m. our time. Just put it on Google. It's going to calculate the time zone for you. But don't miss that class. It's immigration. You guys are not tapping into immigration. And that's another reason why I had to do this class. And I purposely made it free because I want you guys to be there. It's a lot of money to be made. The link for the class, let me see if I can pull it. You just have to sign up. Registration is required for that one. And you'll be good to go. Okay, I'll send it to you right now. So yeah, we're gonna have that panel discussion on medical topics, on healthcare topics for sure. Yep, this is the registration. For those of you that have paid, be on the lookout for an email from my team. Okay, I'm going to send. We still have slot for the multi-million dollar project if you are still interested. I'll send that to you. No, I'm gonna keep it. I don't even want. No, it's fine. 3, 4, 5, 6. Okay, we sold out of South Carolina. Yeah. Oh, we have slot. Okay. Yes. All right, we have one for this one. I'll send it to you guys. So if you want the multi-million dollar project, you can tap on it right there. Okay. Any other question, guys? I want to go meet my babies. They are going back to school tomorrow.
Coach Eli, I just have one suggestion.
Yes, ma'am.
You're moving into an area, this is merely a suggestion. You're moving into an area where consultations, it was easy for me to just click and send you 50 books and, have a conversation with you and it goes on. I really think that you need to look at your calendar and separate it out. this is moving into bigger money for you. Spending $50 to talk to you about something that could really potentially put somebody's life in a different area. Your calendar probably needs to be specific, like the immigration or Medicare or Medicaid or whatever it is we're asking for. I think you need to put links there so that when we're scheduling with you, we are respecting your time and the finances that are connected to your time. I don't think $50 is right because I talked to you for an hour. You let me talk to you for an hour when I was only supposed to be there for 15, 20 minutes. And that's because conversation got good and I am good at what I do and I understand. However, it was still your time. That is my suggestion. Look at that, break it out to those topics so that you know what we're calling for, because you did say, I don't even know what this meeting is for. And you do need to better manage your time because you're about to get busy, sis. That's just me. God dropped that on me and I'm dropping that on you. I'm also going to wish everybody a good night. I had to stay here to say that, to let you know that that was what he sent to me to give to you. And that's it. God bless. Dr. J, I hope to meet you sometime soon. Everybody else have a good night. That was this. I'll see you Wednesday.
Thank you. God bless you. I'll take
Have
note
a
of
good
that.
night.
And I think that's Dr. J's work too. She's probably gonna, because she's into the digital space. So Dr. J, you know what we need to do, right? Because if she's asking
Yeah, I
us to
think I'm
click
gonna
on
have
that,
to get with you and set you up differently so that it's clearly you have a lot of different things, and I totally agree. I didn't want to say anything, but you do, so that we are aware and you know exactly who is coming for what, and that way it's better management of your time. You're so busy, and so God has given you such a big vision, but you only have two hands. So any way that I can assist you, please let me know. I'll work on coming up for something that works with you. We'll work together.
appreciate that. Thank you. Thank you so much. Mira is the newest newbie. She called me 2 days ago. She was so excited. She said, Dr. Coach Eli, I got my location and I got a new client. She was so excited. Mira
Yes,
just got a lot.
I was. And I'm gonna post it on your site so people can see it. So they have to sign up with moms, like you told us, because moms are the one that send it to me. Yep, you were right. Yep, they have to follow your direction and they'll get it.
All right. Thank you. All right,
Thank
guys, I have
you.
to go. I'm tired. I'm sorry. We're gonna connect again on Wednesday. We can't wait to see you. You already know how it's gonna go down. Thank you all so much. And fast forward to Friday and Saturday, we're gonna be here all night as well. Thank you all so much. Have a great night.
Thank you. Bye
Yeah,
bye.
bye.